Look, everybody, I appreciate your being here, and I appreciate, the press being here. Given the back and forth, the politics, we're also here to make some real reforms in state government, real reforms on behalf of the people of Connecticut. We're running a policy-oriented campaign, and today we're going to talk about one of the most important policy reforms we can, health care. As my friend John Garagosian knows from appropriations, if you're really going to bring down the high cost of health care, high cost of government in the state of Connecticut, you've got to go where the money is. Like Willie Sutton said, why do you go to the banks? And that's where the money is. And as Jared points out here, in his placard we've got, discretionary spending, 42% is related to health and human services, and most of that is related to health care. And if we can't fundamentally reform the delivery of health care services in this state with an aging population, we're going to continue falling behind. Our state will never dig out from under the debt, and small business will never have the confidence to keep hiring again. We put in place a bold and comprehensive plan that offers real significant savings, in a variety of places, paying for results, improved health information technology, moving to a medical home model. And we didn't do this by ourselves. We did this putting together a team of all the stakeholders in Connecticut. And this is how you get real reform done. Peter, is a nurse, and Frank is a doctor. We've had the medical community, weigh in a significant way. I'll tell you, we've also had the legislators come in and weigh in as well as we try and leverage off a sustenance and make sure that Connecticut is prepared to take full advantage of what's coming out of Washington, D.C., and we're at the cutting edge of the changes we need. I'm really proud of the fact that we've also had business and labor leaders at the table, front and center, because that's how we're going to govern those folks at the table to make the real changes. I like one of the folks we involved with right down the street when I was a professor at Central Connecticut State. We put together a policy team, and we had a guy named Mike Bertelli. Mike, as many of you know, was at that point, CEO and chairman of Pitney Bowes. And Pitney Bowes has one of the most far-sighted and progressive health benefit plans for its employees. And Mike weighed in on our plan. I'd like to tell you what Mike said. He said, quote, "Good health is good business. Ned's health care plan, Ned and Mary's health care plan, and the collaborative and thorough approach by which he developed it demonstrates that he understands the strong focus on making people healthier and the commitment to driving economic growth. We're never going to get our jobs engine started in this state unless we can start bringing down the high cost of health care." We've had buy-in from some of the leaders in health care reform on the business side. But as you know, if we're really going to deal with the high cost of health care in state government, it's also very important that we have state employees at the table and make sure they know they're getting a fair shot. And one of the folks who was very active as we were putting together this plan is Sal Luciano, Executive Director of ASME, the State Employee Union. And let me just tell you what Sal Luciano had to say about our plan. Actually, he started off by quoting Walter Cronkite, who said, Walter Cronkite once said, "The American healthcare system is neither healthy, caring, nor a system. Ned has proposed a true system that is both healthy and caring because it focuses on prevention and is evidence-based. It will achieve better outcomes while also reducing costs." And this is how you get something done in Connecticut. You get the key stakeholders around the table. You get the medical community there. You get the key legislators from both sides of the aisle. You get the business and the labor community, and we come up with a plan that fundamentally gives us a real opportunity not just to reduce the high cost of government, but better take care of the folks in need. Now that's what we saw here at Walnut Hill. We saw folks taking care of a lot of our parents and grandparents' generation, folks really at need. We salute everything you're doing. We're going to keep faith with you. I'd just like to tell you one last thing. A lot of people worry, oh my God, the aging population, 40% more people over the age of 65, the high cost of health care, it's eating up our budgets. This is an extraordinary opportunity for the state of Connecticut. Some people see a mountain, oh, it's going to be hard to get up to the top of that mountain. Mary and I want to run to the top of that mountain. We want to be the leaders in real bold healthcare reform. When people talk about best practices, we want to make sure they are talking about the state of Connecticut. I see what we got at UConn Health Center and the expansion there and upgrade of the quality there. You see Yale New Haven. You see the biotech and life sciences clusters in this state. You see, we are the home of the payer industry in terms of the insurance capital of the world. We have the financial infrastructure and venture capital. We have the building blocks to fundamentally reform healthcare, not just in the state, but to make sure that when people look around the country, made in Connecticut's going to have a whole new meaning. It's Connecticut that's going to take the lead in our healthcare revolution, and Mary and I would be proud to lead that effort. With that, thank you so much.